So this is a dissection for triangular and quadrangular spaces. So for starting with the dissection, we have to know first few landmarks. So what are the landmarks? We feel the scapula, and in upper part of the scapula, we have to feel the scapular spine. And what we feel again in the lower part of the scapula, we feel the lower angle of the scapula. Now, what we are trying to do is that our first incision is upper one third. Just close it. So, first we feel the scapular spine. Okay. Then we feel the lower limit of the lower angle of the scapula. Now, on the lateral aspect, what we do, we feel the upper 1/3, lower 2/3 of the posterior part of the arm. Now, this is our plane for or the line for our incision. So, if we go along the scapular spine like that way, okay, it is set close to the middle of the spine or slightly medially. Then a vertical line goes to the inferior angle of the scapula. Okay, and this incision around the scapular spine is continued till the upper 1/3, lower 2/3 of the posterior aspect of the arm. Now, another incision, horizontal incision, goes like that way in the arm to the dorsal aspect. Okay, and another incision goes further downwards in front like that way. Now we reflect the skin along with the fascia, superficial fascia laterally. Okay, after reflecting the skin, we get this is actually a continuation of the axillary fascia in this region, back region. So in the axilla we have a fascia like that one containing some fatty structures, some lymphatics, cutaneous nerves, all these things. So all these things is the continuation of axillary fascia and the fascia in the back. Okay. So after reflecting this thing, we clear this space. This is not as it is that we are seeing at this moment. It is filled with fatty structures. Totally filled with fatty structures, totally filled with lymph nodes, all these things. Okay. So we clear this area and we come across few structures. Like this, what are the structures you see? Now see, this is our deltoid muscle. So this is the posterior fibers of the deltoid muscle. Okay. Posterior fibers of the deltoid muscle. So after retracting it, what you see, we again see two muscles. One muscle, another muscle. So this muscle is the teres minor muscle, and the lower one is the teres major muscle. Okay, and another muscle going in this way is the
long head of triceps.
Okay. Now what I got a space in this region, another space in this region, another space over here. Okay, so one space over here, another over here, another over here. Now we try to identify the structures. Now structures, you see, this is one thing that is winding around this space. This is circumflex scapular vessels, artery and vein. Branch of subscapular
artery
or vein. Okay. Now this space is the quadrangular. This is the upper triangular, and see this space very nicely one nerve, which gives a posterior branch over here, supplying the very nicely. You see, it is supplying the deltoid muscle, and an anterior branch like that. So this is the axillary nerve, and the vessels you see in this region is also the posterior circumflex humeral vessels. Okay. So this is the axillary nerve. This is the posterior circumflex humeral vessels. Now in the lower part, again you see this muscle is the teres major, long head of triceps, and there we get, actually this is the medial head, or here more appropriately this is the shaft of humerus. So what are the structure we get? You see very nicely one structure over here, thick nerve. This is radial nerve, and the vessels, posterior circumflex humeral vessels. Oh sorry, profunda brachii vessels. So this is profunda brachii vessels. So this is posterior circumflex in the upper quadrangular space, and here is the profunda brachii vessels, and this is the radial nerve. So there we have the circumflex scapular vessels, there we have the axillary nerve and the posterior circumflex humeral vessels. There we have the radial nerve with profunda brachii vessels. Okay, this is actually artery vein together. Profunda brachii, and this is the nerve. Clear? না এটা এটা কোয়াড্রাঙ্গুলার, এটা কোয়াড্রাঙ্গুলার, এই দুটো হচ্ছে ট্রায়াঙ্গুলার। Now going to the back of the arm. This is here we have the back of the arm. The incision is more or less similar. Lower incision is the epicondyles of the humerus, horizontal incision, and upper incision, upper 1/4 বা upper 1/3 and lower rest of the part. Horizontal incision, vertical incision. Okay, cutaneous nerve only theoretical, not so much asked. Now go to deep structures. Only one muscle. So this is the triceps muscle, and this is the fascia. Okay, these are the two layers of fascia. Probably this is the superficial, this is the thick one, tough one, this is the deep fascia. So this is the deep, this is the superficial. Okay. Now there what you see is the content of the radial, this spiral groove. No. So this is the nerve, radial nerve, and this is profunda brachii vessels. So this is the long head of triceps. This is the long head of triceps. Okay. Here is the lateral head of triceps. And after this, this is the taking origin from the shaft. This is taking origin from the lower part of the shaft of the humerus. Posterior part is the medial head. Okay. So this is the medial head of triceps. This is the lateral head. This is the long head of triceps. It is beneath the medial, beneath the lateral head. Between the long head and lateral head, we get the medial head. And these structures are between the lateral head and the medial head in the groove. So between lateral head and the medial head, we get these structures. Nerve, vessels. Only simple things, nothing much. Good.